All right, everybody, welcome to our third video in our three-part series on home care. So today is about home care products. So we'll talk to you about mouthwash, toothbrushes, toothpaste, and flossers. So before we get into any of that though, just real quick, I want to make sure we let you know that some people who have been through significant gum issues or periodontitis, deep cleanings, there's a lot of special things that we can do to help people take care of their teeth that involve very individualized care, different products, different brushes, all that sort of stuff. This is not for that. This is for your average patient who's never really been through any significant periodontal disease, and this stuff works for most everyone. But just keep that in mind. If your hygienist has walked you through some other special items and you've been through gum disease, where this does not discount that. So. Okay, well, we'll go ahead and get started.
Hi, I'm Stacy, hygienist here at Big Sky Dental Center. I'm going to speak about toothbrushes today. Here at our office, we recommend a soft bristle toothbrush or an extra soft bristle. We actually give away it's extremely soft toothbrush when you come in for your cleanings. If you go to the store, just look for either soft or extra soft. They're actually kind of hard to find. Just stay away from any toothbrushes that are medium, hard, or have the like rubber tips on the sides. Those are really hard on your gum tissue and can wear them away. We are also big fans of electric toothbrushes. We tend to like the Sonicare brand better. It's just a little bit more quiet. The bristles are really soft and you just kind of gently hold it and let it do its work. You don't want to press with using your Sonicare. So either a manual or electric toothbrushes are what we recommend here.
Okay, I'm going to talk to you a little bit about toothpaste. Let's start by talking about what everyone thinks toothpaste do, which is help prevent cavities. And I hate to tell you, but the truth is they don't do a whole lot in that category.
What?
Really, the brushing and brushing well, and if you go back to that video where we showed you brushing technique, you can brush with or without toothpaste, and it's about the same, truthfully, in terms of how good it prevents cavities. So it's really your brushing technique that does that.
Oh, yeah.
If you have sensitive teeth, you can use a product like Sensodyne. You can get it at any drugstore, and if you use that for a few weeks, that can help cut down on sensitivity. But in terms of preventing cavities, all your over-the-counter ones are about the same. We recommend, for over-the-counter stuff, Colgate if you're going to use it. But really the only thing that truly helps prevent cavities better than just brushing alone is a prescription strength toothpaste. This is a Colgate product. It has more fluoride than other toothpastes do. This is what I use most of the time. I either use this or I just brush dry a lot of times, just with no toothpaste.
It's about the only way you can really get it done right.
So the only other thing I tell you is baking soda is great. So if you don't want to go buy something over the counter, baking soda works excellent. It does not give you the minty freshness because it's not flavored, but it's an excellent thing to use for toothpaste and really helps reduce the bacteria in your mouth. So that's it for toothpaste.
Hi, I'm Heather, a dental hygienist here at Big Sky Dental Center, and I'm here to talk to you about floss, the different types of floss, and the different things that we recommend for you. Of course, there's regular just string floss that you can use.
They're nice and clean. Get in between all of them. That's a good boo.
And then we also recommend, I call these cheaters. There are little floss and toss. They have like a little horseshoe shape with floss that runs in between them and a pick end that you can use in between your teeth as well. We also recommend the Reach Access Flosser. This is made by Listerine, has a long toothbrush handle, and then there's little floss replacement heads that you can change out in between uses. This is really convenient. The long handle lets you get in the back teeth really easily. So as long as you're using proper technique, and you can look back at our previous videos to look for technique, just as long as you're flossing once a day, that's what we recommend.
just a quick little blurb on mouth rinses. Here at our office, unless you're going through some form of periodontal therapy, we typically don't recommend a mouth rinse. If you want fresh breath, if you could get the Listerine brand, it's the only brand that's actually approved by the American Dental Association, has the actual seal of approval on the back. So we do have little bottles if our patients ever want it. There is alcohol free. That's really good. It just doesn't dry out your oral tissues as much. If you're a patient who's going through orthodontics and you want a little bit extra fluoride, the brand Act is actually really good as well. But besides just for a fresh breath, you really don't necessarily need to use an oral mouth rinse.